In this episode, we'll explore two conditions that affect millions worldwide: endometriosis and polycystic ovary syndrome, or PCOS. By the end, you'll understand how they differ, how they affect fertility, and the latest management strategies. Endometriosis occurs when tissue similar to the uterine lining grows outside the uterus. PCOS, on the other hand, is a hormonal disorder where ovaries develop multiple cysts and ovulation becomes irregular. Both the conditions disrupt reproductive health, but in different ways. Endometriosis is estrogen-driven, while PCOS is linked to excess androgens and insulin resistance. Think of endometriosis as a tissue growth disorder and PCOS as a hormonal imbalance disorder. These differences explains why their symptoms and treatment diverge. Researchers are still uncovering genetics, environmental, and lifestyle factors that contribute to both conditions. But one thing is clear: they are distinct, not interchangeable. Studies reveal that both the conditions can cause menstrual irregularities and infertility, but their hallmark symptoms differ. Endometriosis is often associated with severe pelvic pain, painful periods, pain during sex, and heavy bleeding, while PCOS is more associated with irregular cycles, acne, excess hair growth, weight gain, and sometimes hair thinning. These symptoms can overlap, which is why diagnosis can be tricky, causing many women to spend many years seeking answers before receiving proper diagnosis. Now that you've understood what they are, their causes, and symptoms, do you know the impacts on fertility? Endometriosis can cause scarring and blockages in reproductive organs, making conception difficult. PCOS, on the other hand, prevents ovulation, which means the eggs are not released regularly. Both the conditions can make fertility challenging, but here is the truth: many women successfully manage these obstacles and achieve pregnancy with the right medical approach. Endometriosis is diagnosed through laparoscopy, which is a surgical procedure that allows doctors to visualize the growth directly. PCOS is diagnosed with blood tests, hormone levels, and ovarian ultrasound, while treatment depends on the condition. For endometriosis, management includes pain relief, hormonal therapy to reduce estrogen, and sometimes surgery to remove lesions, while PCOS management often starts with lifestyle changes like diet and exercise, hormonal therapy to regulate cycles, and insulin sensitizing medications. Remember, both conditions require individualized care, and treatment is often a journey rather than a quick fix. In a nutshell, endometriosis and PCOS are two distinct but often overlapping conditions. Endometriosis is driven by tissue growth outside the uterus, while PCOS is rooted in hormonal imbalance and insulin resistance. Not forgetting that both can cause significant symptoms and affect fertility. Therefore, by understanding these conditions, we can reduce stigma, improve diagnosis, and empower women to seek the support they need. If you suspect you may be experiencing symptoms of either condition, remember, professional medical guidance is essential. Thanks for joining this deep dive into women's health. My name is Skylar. If you found this video helpful, subscribe and share with friends, family, or colleagues to help raise awareness. Drop your questions or experiences in the comments below. Don't forget to explore our women's health and wellness playlist for more explainers. Stay curious, stay informed.